Hello folks, after the Hanta virus outbreak, we have got another breaking news. Yes, another breaking news. Now we have got the Ebola virus outbreak in the African continent in the countries of Uganda and the Democratic Republic of Congo. To the extent that the World Health Organization has declared this Ebola virus outbreak as a public health emergency of international concern. This Ebola virus disease in the Democratic Republic of Congo and Uganda has been caused by the Bundibugyo virus strain of the Ebola virus. At the moment, as of today, that is the 18th of May 2026, there have been more than 250 suspected cases in these two countries and almost 80 suspected deaths. But so far, according to WHO, there have been 8 confirmed cases, and at least we know that one death has been confirmed to be caused by the Ebola virus, though it is assumed that there would be many more. According to WHO, this event meets the criteria for a public health emergency of international concern under the International Health Regulations 2005. Now let's talk about what is Ebola virus disease. Now Ebola virus is a rare but severe disease caused by the Ebola virus, which is a member of the Filoviridae family. It can affect humans as well as non-human primates. As far as we know, the reservoir are the fruit bats that are believed to be the natural reservoir of this virus. As far as the strains of Ebola virus are concerned, there are a total of 6 strains of this virus which causes outbreaks every now and then. Of them, the most deadly is the Zaire Ebola virus. Then we have got the Sudan Ebola virus strain. Then we have got the current one that has caused outbreak in the Democratic Republic of Congo and Uganda. That is known as the Bundibugyo strain of Ebola virus. Then the other virus strains that we have got are the Thai forest strain. We have got the Western Ebola virus strain, and we have got the Bombali Ebola virus strain. Now, as far as the incubation period of this virus is concerned, it can be anywhere between 2 to 21 days. It can be as early as 2 days, it can be as late as 3 weeks, but somewhere on average it is 8 to 10 days of incubation period, after which the affected individual they start to have symptoms. The early symptoms are non-specific. They are just like the symptoms of any generalized viral infection. They are fever, generalized body aches, severe headache, fatigue, and maybe a sore throat. As the symptoms they progress, then in a few days it can progress into more severe symptoms like progressive vomiting, loose motions, severe abdominal pain, maybe a rash can come up on the body, and then it leads to impaired kidney and liver function, which can lead to raised liver enzymes and raised creatinine. Severe cases, if it goes into that severe phase, then it can cause severe internal and external bleeding because of the activation of the coagulation cascade, which can lead to multi-organ failure and septic shock, which can ultimately lead to deaths of these patients. And that's why the mortality in Ebola virus is very high. 40 to 50% is the case fatality rate. Now, why this outbreak is concerning at the moment, which has happened in the Democratic Republic of Congo and Uganda, is because number one, we do not have any approved vaccine for this Bundibugyo virus strain. Also, we do not have any proven monoclonal antibody therapy for this virus. Then we have seen that there has been a cross-border spread between the Democratic Republic of Congo and Uganda, and there is a fear that it can cross into the adjacent countries as well. We also have got limited diagnostic and surveillance tools for these countries, and then as far as these two countries are concerned, there are a lot of security challenges in these affected regions which can impair the monitoring and other types of activities to contain this illness. Now, as far as the diagnosis is concerned, the real-time PCR is the gold standard of diagnosis, for which the samples like blood, oral secretions, tissue samples can be taken and can be tested. Now, the million-dollar question is how it spreads. Now, it can spread from person to person. If an individual person comes in close contact, obviously through the body secretions and other direct contact, it can spread from one infected individual to another one. It can also spread through contact with the infected bats or animals. It can be caused by direct contact with the infected body fluids. It can spread because of contact with contaminated objects. Now, as far as the treatment is concerned, there is no specific treatment for this virus. all the treatment is all supportive. Majority of these people have got very severe illness, so they eventually land into the intensive care units, where obviously you give them fluid and electrolyte therapy to obviously maintain their physiology. Sometimes they might need respiratory support in the form of ventilation, and those people who have got renal failure, they might require dialysis support in the intensive care. Now, as far as the prevention of this virus is concerned, obviously hand hygiene is very important for prevention. Then obviously avoiding contact with the animals, using the personal protective equipment for those people who are caring for the affected people, and obviously where this virus is spreading, then maintaining social distancing and isolation are the keys of prevention for this virus. So these were a few things that I wanted to talk about the current Ebola virus outbreak in the African continent. If you've got any further questions about this virus or anything, because this is a short video, and if you've got further questions, put it down in the comment section below, and I will be more than happy to answer your questions and queries. So have a very safe day, have a very good day, take care, stay safe, bye bye.